Good afternoon and welcome from the Office of the National Coordinator for Health Information Technology. Today's presentation is the Notice of Funding Opportunity for Assessing Use of Health IT by U.S. Physicians Providing Outpatient Care. Today's agenda will include an introduction of speakers, reminders, the Notice of Funding Opportunity, Purpose and Goals, the application process, and the merit review criteria. Today's speakers will include Jordan Everson of the Office of Data Analysis Branch, Tavon Taylor and Yolanda Thompson, Grants Management Specialists for merit review with ONC's Procurement and Grants Division. Just a few reminders. This webinar is being recorded and will be made publicly available after the presentation. All participants will be muted during the presentation. If you have questions, please enter them into the chat box. And please note that all questions will be answered in the form of an FAQ, which will be made publicly available on a weekly basis. The webinar and FAQs will be made available at www.healthit.gov/topic/ONC-funding-funding-announcements. To ask a question today, use the chat function. Along the bottom of the webinar window, you'll find and click the chat box button. Input your question and then press send or enter or return. And again, if you have additional questions after today's webinar, please direct them to the following email address: physicianhitsurvey@hhs.gov. I will turn it over now to Jordan Everson to give you some background information on the program.
Hi, everyone. Thanks for joining today. I'm going to walk through some of the program-specific information here, starting with the Notice of Funding Opportunity, Purpose, and Goals. So by way of background, interoperable health information technology is defined as enabling the secure exchange of electronic health information and use of that information from other technologies without special effort on the part of the user. And this is a paraphrase of the 21st Century Cures Act definition. Several federal health IT policies, including those propagated by ONC, have sought to advance the use of interoperable health IT among healthcare providers. But existing evidence indicates a need to improve interoperability. For instance, in a survey of primary care physicians in 2018, the most commonly cited improvement to health IT that primary care physicians desired was improvements to interoperability. And then in a 2022 survey of family physicians by the American Board of Family Medicine, this reported that most physicians were only somewhat satisfied with their ability to access information from other organizations as enabled by interoperable health IT. And less than 1/4 of physicians indicated it was very easy to use that information to treat their patients. So the purpose of this Notice of Funding Opportunity is to support work to conduct national surveys to assess the extent to which physicians use interoperable health IT and their experience using that technology to support the effective care of their patients, essentially furthering the evidence described on the prior slide. This also is intended to provide insight into whether federal policy is having the intended effect of leading to better health enabled by data, and to highlight remaining challenges, inadequacies, and pain points, all of which is intended to inform ongoing policy and coordination work by ONC and other federal agencies. The NOFO has 5 specific performance goals. As described in that document. The first is to develop survey questions that align with physicians' understanding and use of health IT to support key measures on interoperability. Second is to ensure that survey questions will result in high quality and valid data. Third is to actually collect survey responses from US physicians providing outpatient care to produce national level estimates with a response rate over 50%, which we note is the national average of responses from healthcare professionals as published in recent evidence. The fourth is to collaborate and coordinate with ONC on the analysis and interpretation of results and publication of written products. As I'll discuss further, this is a cooperative agreement which entails substantial involvement from ONC staff. And fifth is to develop a strategy for continued valid and representative measurement of the use of health IT that is intended to go beyond the survey put into the field. Next slide. So as I said, this is a cooperative agreement, and so ONC's purpose is to support and stimulate the recipient's activities by involvement with the recipient. Say it is not to assume direction, prime responsibility, or a dominant role in the activities. As part of this substantial involvement, ONC and the recipient will be in contact monthly, and when appropriate, in kind of crunch times more frequently. ONC involvement will cover a range of guidance, including on the sampling approach and data collection strategy, development of content for measurement, guidance on timelines, quality assurance approaches, collaboration on data analysis, participation in the selection of key personnel, review and approval of substantial provisions of proposed sub-awards or contracts, review and approval of deliverables, guidance and feedback during project execution, and collaboration in developing an ongoing measurement strategy. Eligibility for this cooperative agreement is relatively broad. It includes domestic entities, public or private entities, nonprofit or for-profit entities. A few key details for the award. Again, it is a cooperative agreement. The available funding for the award is $425,000 and intend to make one award. The application due date is July 22nd, so a little bit over a month from today. The anticipated award date is August 30th, and the program is intended to start on that same date. The project period is for 5 years, starting August 30th, 2024, and running through August of 2029. The budget period begins August 30th and runs through August 29th, 2025. And so in essence, the available funding is intended for that initial budget period, and funding of future non-competing continuation awards is conditioned on the availability of funds, satisfactory progress by the recipient, and an awarding office determination that continued funding of the award is in the best interests of the government. With that kind of overview, next, I'd like to talk about the specifics of the application process and contents of that application. First, applicants are strongly encouraged to submit a non-binding email letter of intent to apply for this funding opportunity. And the letter of intent due date is June 28th, 2024. And submit that letter of intent by sending it to physician HIT survey at hhs.gov. In that letter of intent, identify the title, the name of the applicant organization, the city and state of the applicant organization, and the NOFO number. Following the letter of intent and submission of the application itself, all materials would be submitted electronically through grants.gov as outlined in the NOFO. You can contact the grants.gov help desk at support@grants.gov or call at 800-518-4726 for assistance with submitting applications on grants.gov. Important to note that in order to make this submission, you'll need to have a unique entity identifier. UEIs can be obtained via registering at the URL listed here. And it typically takes 7 to 10 business days to obtain that. So you need to plan ahead to ensure you have a UEI prior to the grant submission date. Similarly, you'll need to register in the System for Award Management, SAM, at www.sam.gov and use your UEI. The SAM registration process takes 7 to 10 business days. So please plan accordingly. If you have already registered with the SAM, but have not renewed your registration in the last 12 months, you will need to renew your registration. So given that the application due date is in a month, some of these things should be started shortly. And then, of course, as you prepare the application, ensure that the application meets requirements and page limits that I'll describe in a moment. So the application is composed of a number of components. First is a project abstract of less than 500 words. Second is a project narrative of 200 pages. And then a number of supporting documents, Form SF 424, application for federal assistance, Form SF 424A, budget information for non-construction programs, Form SF 424B, assurances for non-construction programs, Form SF LLL, disclosure of lobbying activities, a budget narrative, letter of commitment, proof of nonprofit status, if applicable, and indirect cost agreements. Other than the project abstract and narrative, these documents do not have a specific page or word limit. Okay, so the project abstract should be a clear, accurate, concise abstract that can be understood without reference to other parts of the application, and that provides a description of the proposed project, including the goals, objectives, overall approach, anticipated outcomes, products, and duration. So it should be 1 page, no more than 500 words as stated, include the project title, should include the project's goals, objectives, overall approach, anticipated outcomes, products, and duration. And then personal identifying information should be excluded from the abstract. The project narrative should address the elements articulated in the areas of interest section of this NOFO. The project narrative should align closely with the performance goals and, importantly, the merit review criteria, which I'll describe later. The project narrative should be double-spaced, no more than 20 pages, formatted to standard letter size, plain white pages, using either Cambria or Times New Roman font, with 1 inch or larger margins and font size of 11 point or greater. The project narrative, there are several components that the project narrative should include, and these components will be counted as part of the overall page limit of 20 pages. The links here are suggested links of the components and are guidelines to help applicants create a balanced document. They're not mandatory restrictions. So the parts that should be included here are discussion and understanding of the project at about 1 to 2 pages, personnel qualifications and past performance, 2 to 5 pages, management plan and budget at 1 to 2 pages, and the technical approach at 5 to 10 pages. The next several slides, I'm going to walk through components that should be included in each of the parts of the project narrative. And so these are items, these items are guidance, they're things that should be included, and I think are complemented well by the merit review criteria, which are the criteria by which a panel of reviewers will evaluate each application. So the discussion and understanding of the project should describe the applicant's understanding of the project in the broader context related to the goals of the cooperative agreement, and it should discuss the current state of health IT, including the current health IT policy and regulatory landscape related to the goals of the cooperative agreement. Personnel qualification and past performance. Here we should describe your personnel qualifications and past performance to demonstrate experience consistent with successfully meeting the goals of the cooperative agreement. And again, this is a place that intersects importantly with the merit review criteria because there is a substantial weight on this section. The management plan and budget should discuss the overall project management approach, the types and level of staffing, resources, and infrastructure in place to support measurement under this cooperative agreement, should identify the roles of key staff, subcontractors, and other external consultants or subject matter experts, And the applicant must provide the names of staff that will be overseeing the analysis of the data and preparation of the ongoing reports. To continue, contents for management plan and budget should include an approach to maintaining a project plan, ensuring the program goals previously listed and milestones are met, and a plan for collaboration and communication with ONC, including provision of progress reports, but perhaps beyond that as well. And this section should also include a proposed budget. The next section, the technical approach, is the longest section of 5 to 10 pages, and so broken into several slides and several subcomponents. The first is sampling strategy, where the applicant should describe the approach to obtain data on a national sample of US physicians. That is to say, not centered on specific states or regions, and those physicians should provide outpatient care rather than practice in a hospital or other setting. It should describe collection of data that represents diverse range of practice settings, rural versus urban setting, specialty type, practice group size, etc. And then it should describe how the applicant will target physicians providing direct patient care rather than working in perhaps administrative or research roles. The next section of the technical approach should be the data collection strategy, where applicants should describe the approach for data collection, including the method and modality, the approach for identifying and targeting physicians as opposed to front desk or office staff, any anticipated challenges in reaching the target population, and strategies to address those challenges. And that might include outreach efforts and how contact will be made. And ultimately, an approach to achieving a response rate of 50% or greater, such as an approach for follow-up with non-respondents. Here again, recognizing 50% or greater for healthcare professionals is a rate shown to be kind of the average in recent published literature and important for mitigating non-response bias. The next section should be developing content for measurement. Here should describe plans to develop and finalize measures to meet the goals of the cooperative agreement. We've listed a number of example topics for consideration in this content, including the use of certified health IT, health information exchange activity, because the experience with, satisfaction with, benefits from, and barriers to interoperability as experienced by physician respondents, health IT usability and provider burden, responsible use of artificial intelligence in health IT, patient engagement, telehealth, and support for public health activities. The next subcomponent of the technical approach is the data quality and delivery section, where you should describe plans to ensure the selected measures will be well understood and result in valid responses, processes for properly coding and cleaning the final data set, processes to assure the quality and completeness of the data, and how the applicant will provide the final data set and related documentation to ONC. The next section of the technical approach is the data analysis, interpretation, and publication subcomponent. Here you should describe the approach to analyzing, interpreting, and disseminating results, use of any subject matter experts, including consultants or panels, in informing interpretation of results, data analysis plan and strategy for disseminating data findings, and that should include an approach to coordination and collaboration with ONC on the production of these products. And similarly, an approach to interpreting and presenting findings to ONC staff, leadership, and federal partners, which may also include the use of an expert panel to interpret the data. The last two subsections of the technical approach are the timeline and approach to making data available to others. Timeline would include a cadence for key project milestones, should reflect the first year of the project plan, and should be able to be projected over the full 5-year project period. Approach to making data available to others should include a description of a plan to make a de-identified or limited data set available for use by the public, and any governance and review processes in place to, or that would be put in place to provide access to that data as the applicant believes appropriate, given that the nature of the data collection effort. Finally, the technical approach should include a strategy to address gaps in measurement. Here, the applicant should describe a plan to identify gaps in the survey based on sampling strategy, data collection strategy, or analysis of the first year of data collection for things like non-response bias or the resulting characteristics of respondents. This strategy should describe strategies to address these gaps, including the use of alternative data sources, partnerships with other organizations, or alternative outreach approaches. So essentially be an analysis of the resulting product and how it might be complemented by other work. And this could include use of other data sources beyond survey work, such as metadata derived from health IT. That concludes the description of the project narrative. The next section is the budget narrative. And this section should include a detailed breakdown of how the applicant plans to spend the allotted resources to complete the activities detailed in the NOFO. Budget narrative. This includes a budget narrative on how the proposed budget, as articulated in the SF 424A, aligns with the applicant's project narrative. Includes the application for federal assistance form SF 424, budget information for non-construction programs, assurances for non-construction programs, and disclosure of lobbying activities, each of which are standard forms. And then I'll note that additional detailed budget instructions are provided in the notice of funding opportunity. Okay, so that is the overview of the application process, including some detail on what should be included in the project narrative and the technical approach. A key companion to that is understanding the merit review criteria. We'll walk through that next. So again, in terms of the application process, submit all application materials through grants.gov. Grants.gov then issues an email receipt upon successful submission. Applications are first reviewed for responsiveness and categorized as pass, fail. That is to say, does it include the necessary components? All applications that pass the review for responsiveness are forwarded for merit review, which is completed by a panel of experts. Once the merit review is complete, ONC will make an award, may make an award. ONC is not obligated to make an award if none of the applicants meet the intent of program requirements or if there's a change in funding levels or availability. For the application responsiveness criteria, all applicants must meet the following completeness criteria, or they will be administratively eliminated and not sent forward for merit review by a panel. So the applicant must meet the eligibility criteria. The application must be received by the deadline of Monday, July 22nd, 2024 at 12 p.m. Eastern Time through grants.gov. The application must contain all required components, including the project narrative, SF424, etc. The application must meet all formatting and length requirements. And appendices and attachments are not used as a mechanism to exceed page limits of the project narrative. Following the review for responsiveness, applications will be forwarded to merit review. And merit reviews will be conducted by a review panel of at least 3 experts in their field from academic institutions, nonprofits, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. 10 points are assigned to the discussion and understanding of the project. 40 points are assigned to personnel qualifications and past performance. 10 points are assigned to the management plan, 15 to the budget, and 25 points to the technical approach, making a sum of 100. So here we'll walk through the specific criteria that the panel will use to evaluate applications. First, for the discussion and understanding of the project, look for the applicant demonstrating knowledge and understanding of key issues related to adoption and use of interoperable health IT by physicians and survey methodology to address those issues. And that the proposal addresses the purpose and objectives of the NOFO. For personnel qualifications and past performance, which are assigned 40 points, the criteria here are to demonstrate prior data collection efforts on physician experience using health IT at the national level among US physicians, including an assessment of the quality of that data collection effort, and importantly, whether it generated a high response rate. In addition, look for evidence of past work producing reports and publications on health IT from those data collection efforts. Continuing the personnel and qualification criteria, look for data collection and survey development infrastructure and resources to conduct a national level survey of US physicians providing outpatient care, so the existence of that infrastructure. Relationships with physicians or physician organizations to facilitate survey development and recruitment of respondents, and physicians on staff with subject matter expertise in health IT and interoperability that can support measurement development needed for the cooperative agreement. The next section here is the management plan, which is assigned 10 points. And here the criteria are that it describes a clear and workable plan to meet program goals and ensure program milestones are met, provide the name of staff that will be involved in the management and technical approach of the project, describes a workable plan and timeline for managing and evaluating development of survey content, an effective plan for managing data collection and delivery of data, provides a proposed timeline for fielding the survey, and describes an approach to collaborate with ONC on development of written products, including proposed roles and responsibilities. The budget section worth 15 points. The criteria here are that the budget is sufficiently detailed to explain how they will use the award funds to conduct the survey, and the proposed allocation of the budget is in line with the goals of the cooperative agreement. The last section is the technical approach, assigned 25 points. And here the criteria are that the approach is succinct and logical, methods are consistent with the goals to be accomplished. It's a clear and detailed approach for developing and finalizing survey content. There's a detailed and robust approach to collecting information to produce estimates on key health IT measures with that response rate over 50%, as discussed previously. They describe an analysis in the dissemination plan likely to result in wide use of the results by policymakers and researchers. Clearly identify an approach for verifying the validity and accuracy of the data through cognitive interview, audits, or other appropriate means. And that they describe an approach developing a strategy for valid and representative measurement of the use of health IT beyond what is proposed specifically in the survey, and one that complements the survey that the applicant plans, as we've previously discussed in the technical approach to the project narrative. With that, I will hand the session back to Yolanda to walk through the process to submitting questions.
Great, thank you, Jordan. All questions must be submitted in writing via the chat session during this webinar, or you can email them to physicianhitsurvey@hhs.gov. And remember, all questions submitted in today's chat will not be answered today. They will be answered in the form of an FAQ made publicly available at 3 p.m., around 3 p.m. each Friday, and can be found at the below link. Thank you for joining today's information session. We will remain on the line for 5 minutes to allow you additional time to post your questions in the chat. To see the NOFO, please log on to grants.gov and apply to the grants.gov/results-detailed/354966. And for assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call 800-518-4726.